Kidney or renal cancer accounts for 3% of all adult cancers in the United States. Early detection often means successful treatment. We spoke with Dr. Adam Hickerson of Pomona Valley Hospital Medical Center to learn about symptoms and recommended treatment.
Tumors in the kidneys, for better or worse, are becoming increasingly common. Part of the reason is we're finding them more often. And so people used to die with small tumors in their kidneys, and they were never known about. They were generally only found when they were large, caused bleeding, were palpable, or caused pain. And unfortunately, at that time, they're really not very well treated. It's usually large surgery, and the recurrence rate can be high. With today's technology, most people come in to the ER or primary care doctor's office, and so they either get an ultrasound or a CAT scan for some other reason. So we've actually been picking up quite a few more than we have in the past. The good news is, although they're more common, they're very treatable and very curable when they're caught early. Traditionally, there were three main symptoms, like actually a palpable kind of mass or fullness in the belly, pain, and then blood in the urine. But it's pretty uncommon nowadays that we find really any of those three. Most of them are simply done for cough or constipation or some other reason that someone gets a scan of the abdomen.
Dr. Hickerson told us about the types of tumors usually found.
There's several different types of tumors, and they can range from being completely benign, so never spreading or causing damage, to invasive cancers. There's a few tumors that we can diagnose simply based on the CAT scan. Some of them contain fat or other kind of unusual things which we can immediately tell they're benign. Some of them are cystic, and so they're not actually solid. However, traditionally, solid tumors we treat as a cancer. Some small tumors can simply be watched, and so we're finding that is increasingly common as people are frail or elderly. However, the first choice in people who are healthy and willing and physically able to undergo a procedure, generally we want to remove the tumor. And so for most people, a surgery is usually kind of the recommended course. Surgical treatment of kidney tumors has been evolving over time as well. Traditionally, if there was a tumor, people removed the entire kidney. The concern was margin status or recurrence, and we thought a little bit less about renal function. We always kind of thought cancer trumped renal function in terms of removing the tumor. As we've diagnosed more of these and they've become smaller, a lot of people have really made a push to just remove that part of the kidney. So a partial nephrectomy, which is just removing that section with the tumor, has become hopefully the standard of care for most centers, where if it's at all possible, we want to save as much kidney as possible. Even more advancement has come with the use of robotics, and so we're actually now, with the advancement of robotics and very good manipulation inside the body, sophisticated tools, we're now able to do a lot of this minimally invasively.
Removing only part of the kidney has benefits for the patient.
There's actually a survival benefit for those who have had only part of their kidney removed. So before, we were thinking that there may have been a disadvantage by just removing that part of the kidney because there would be a higher recurrence rate. It's actually the opposite now. We've found that having that extra kidney around, for some reason that's not quite clear just based on numbers, those people have actually had a higher survival rate when they're followed over a period of time. So that's been really partially making the drive for us to try to save as much kidney as we can while removing all the tumors.